Anesthesia. Anesthesia is a treatment using drugs called anesthetic. These drugs keep you from feeling pain during medical procedures. Anesthesiologists are medical doctors who administer anesthesia and manage pain. What is anesthesia? Anesthesia is a medical treatment that keeps you from feeling pain during procedure or surgery. The medication used to block pain are called anesthetics. Different types of anesthesia work in different ways. How does anesthesia work? Anesthesia temporarily blocks sensory pain signals from nerves to the centers in the brain. Your peripheral nerves connect the spinal cord to the rest of your body. Who perform anesthesia? Anesthesia requires numbing a small area. The person performing your procedure can administer the local anesthetic. For more complex and invasive procedures, your anesthetic will be administered by a physician. Codes and modifier. Any claim for a professional healthcare service must clearly communicate what service procedure was performed and why it was done. To provide clarity and standardization, the administrative simplifications provides within the Health Insurance Probability and Accountability Act of 1996 HIPAA requires all covered entity to use specially designated codes set on claims of services. Procedure and services are reported with codes and modified from the CPT code set. CPT stands for Common Procedural Terminology, and this code set is owned and maintained by the American Medical Association. Anesthesia codes, sometimes referred to as ASA codes, are part of the CPT code. CPT is a what terminology of the CPT? Codes and modified from the CPT code set. CPT stands for Common Procedural Terminology. ASA codes are part of the CPT code set. Examples of CPT codes applicable to anesthesia include 00790 is a CPT code. Anesthesia for interperitoneal procedure in upper abdomen, including laparoscopy, not otherwise specified. 01402 anesthesia describe for anesthesia care for limited and specific service. CPT modified 22 increased procedural service is an example of a CPT modifier that may be used with anesthesia code as explained in the ASA Relative Value Guide. This modifier is used to report instances of field avoidance and the increased work and complexity that follows. HIPICS modified descriptor AA. Anesthesia service performed personally by the anesthesiologist. AD. Medical supervision by a physician. More than 4 concurrent anesthesia procedure. QK HIPICS modifier uses descriptor is a medical direction of 2, 3 or 4 concurrent anesthesia procedures involving qualified individuals. HIPICS modifier QX is its descriptor is qualified non-physician anesthesia service with medical direction by a physician. QY HIPICS modifier uses medical direction of one qualified non-physician anesthetist. Is anesthesia is a painful? Can you sleep after anesthesia? Some people feel sleepy but otherwise fine as the anesthesia wears off. Otherwise have side effects such as nausea or chills and sometimes vomiting. Your throat may be sore from a tube that help you breathe during surgery. Why do people cry after anesthesia? Tell me in description. CPT code 00100 specify anesthesia, followed by a description of a surgical intervention. CPT codes 01916 01933 describe anesthesia for radiological procedures. Please subscribe and like the videos. May Allah give your mother long, healthy life.